Hello and good afternoon, everyone. My name is Nicole Morris, a student at the University of Arizona's Global Campus, studying course Psychology 640, Psychological Testing and Assessment, instructor Dr. Hausch. Today I want to present ethical and professional issues in psychological testing. On the first slide we have ethical and social implications of testing. The ethical and social implications vary depending on psychological assessments and whether the professional is working with an adult or child. A psychological professional must understand that children have different levels of cognizant or brain development than their adult counterparts, so assessments requirements will vary and must be uniquely tailored. For instance, minors, when professionals are dealing with minors, they have to understand that they're not mentally fully developed. They cannot legally consent to any participation in assessments or testing. You're going to have to get parental guardian consent. They may not understand the test, which can lead to faulty, inaccurate results. They can also, professionals needs to be aware that minors can also be ridiculed from peers. Like, for example, if a psychologist comes and gathers a student from the classroom, they might go back to that same classroom when they're done and get teased by their peers for various reasons. Kids are mean. Guardian informed consent is a must, and also dehumanization. Like, sometimes professionals need to be mindful how they are talking to children, and they need to get on their level and treat them as if they're human. Adults are more mentally developed. They can give legal consent. Confidentiality is a must for both minors and adults, anybody that the psychological professional is dealing with. Both minors, adults, they have the right to withdraw at any time. Issues that can arise are deception, or if the psychologist didn't debrief their participant or who they're evaluating enough. And again, it is important to debrief and not have any deception whatsoever in your studies and assessments or testing. The next slide, we are going to go talk about professional responsibilities when conducting ethical tests and assessments. It is the professional psychologist's responsibility to be observant, to have validity in their tests and assessments, have reliability. It's the user's responsibility to listen coherently, read all the directions, perform at their best, to always apply honesty, integrity, so that way the tests and assessments can have ensured correctness overall to the best of everyone's abilities. Publishers should always be observant of participants and vigilant, as many individuals may not disclose their disabilities, especially young participants. Gregory, 2014, affirmed that young examinees are relevantly known for the refrainment of their disabilities or hearing loss for numerous reasons, which may include embarrassment or unawareness. Unawareness can happen in minors due to illnesses that may have caused temporary hearing loss that they may not be aware of. Many individuals do not think informing professional assessment psychologists, as they feel it's not essential knowledge, as they are not cognizant of how it can affect the overall test results. Therefore, it's the professional's job to also be pertinent and mindful and aware of things that might not be said. So like if the psychologist is talking to somebody they're assessing and they keep asking, what did you say? Or then that might indicate, okay, they're not hearing me correctly, so how can we address the situation? Testing issues that are related to linguistics and culture diversities that psychologists might have arise in their assessment is many issues such as individual cultural aspects and linguistics can cause unclear communication barriers between the examiner and the examinee. If culture and language barriers are not considered when testing, the integrity of the psychological assessment can weaken the test's validity and reliability. Ortez et al. 2012 surmised that mixed culture and language differences could dilute assessment and testing variables through a lack of understanding and misconceptions. For example, one's definition of the same word can have two individual meanings and neither connotation is wrong. Words are based primarily on culture learnings, which differ from, household to household, individual to individual. The example can be amplified when barriers of languages are intercepted and lack of understanding diminishes communication. Lack of understanding can diminish the assessment's reliability and validity due to examiners' gathered notations of what the tester conveys, leading to faulty biases, which we don't want in any of the assessment's results. And what I mean by one word having two different meanings per individual is, my definition of a word, such as like peace or love, or, can mean something totally different to somebody else, especially if they have a secondary language, So that's just something to be aware of. Going over what reliability in an assessment or test means psychologically, it means that repeated outcomes stay within the same validity. Test worthiness, control, data obtained, test retest results are within the skewed measurements, examined evidence. Reliability is repeating an assessment or test that yields similar results. Meeker et al. 2022 affirmed that if an assessment's findings are widely spread, then the configurations of the data are considerably less reliable, and why the professional must obtain closer distribution for test trustworthiness. And what that means is considered reliable when assessing and testing a participant, implying their scores are repeatedly within the same statistical mean for each occurrence of examination. Therefore, the examinee's standard deviation needs to contribute to the reliability of the assessment to allocate standard error. Simply put, it means there are going to be configurations such as the participant not sleeping well, which indicates why he did poorly on the same test one time and not the next. Maybe the next day he got more sleep and was able to cognitively think more accurately. There will always be errors, but it is considered reliable if the assessment stays within an allotted configuration. Life is imperfect, where randomness is bound to happen and is often uncontrollable. A good way to look at reliability too is if you take one population from, like, say, New York, one population of sampled people from Utah, and you run a test or assessment and you keep getting the same answers over. Here's a quote that stuck out that I thought worth sharing. A psychological test is a limited sample of behavior. And what that means is time is a variable restraint that neither the participant nor the examiner has to sufficiently dedicate to testing. That means all the aspects that one wants to initiate into their assessment can't possibly be done because there's so many variables of life that just cannot fit in. So it has to be a smaller sample of that assessment. Even if the test or assessment is well executed and defined, the test cannot possibly measure all variables in question adequately and sufficiently. Therefore, the assessment will contain some degree of measurement errors indefinitely. I really like visuals, and as I added onto this slide, you can see what it means to have validity and versus reliability. So you can see there's one target that the results are in the same depicted area. That's reliability. Validity comes in the very right depiction image when it's all clustered on the target. That is when you have both reliability and validity in an assessment. Validity and reliability differ considerably, but must be obtained in each psychological assessment or test to obtain levels of accuracy, evaluations, analysis, and reporting. Reliability is consistent where validity is accuracy, as seen in the image. It is imperative that psychological tests have both in order for it to be accurate. On this slide, we have two different diagrams to discuss the different types of validity and extra validity concerns related to testing. The first one is face validity, which is fundamental measuring to test the value of a variable such as a questionnaire. That is a factor of happiness. Could be, not always. You can do different tests, of course, but this one is depicting hand-eye coordination and different variables But the important to note about face validity is that psychologists and other researchers can look at it and take it as face value. That's why they call it face validity. Dunn 2020 confirmed that validity is like a two-sided coin, imperative to note that one cannot understand one side without first researching the other. Psychometrics is essential when testing the validity of any test or assessment to ensure desired accuracy. The next one we have criterion-related validity, which is used to predict future or current performances with interest. So, for instance, a high school student wishes to attend college to become a psychologist. Their recent GPA scores in relation to psychology criteria can be studied and help determine how well that student might perform in their future. On this slide, we can see the validity diagram and all the different branches, and it really puts in perspective how many different types of validity that there can be congruent in tests and assessments. And I thought this was an appropriate diagram, so if you want to research on your own, you can look at all the different examples here. On this slide, we have clinical and statistical predictions of mental health decisions. Clinical professionals usually work off observations, meta-analyses, professional predictions, observations, preventative measures, notating symptomologies. Statistical side, we have greater accuracy, formulations, aids in clinical efficiency, future predictions. It's less costly. Psychologists use meta-analysis to aid in professional predictions on the some subject to aid in the determination of the probability and likelihood of certain phenomena in mental health. Agistar, et al. 2006 surmised that clinical psychologists should utilize it more when available due to the evidence supporting statistical methods. Using statistics to present data, give visuals, and make it easier to comprehend, yielding more comprehensive overviews. Regardless of training or statistical variations to determine probabilities, standard variation errors can occur, especially when studying human behaviors, as they are random in frequencies of uniqueness. Both clinical and statistical aspects can support the probability of proper diagnoses and assessments of individuals. However, they are equal, greater, or weaker when utilizing them singularity, independent of assessments. So, in other words, both clinical and statistical probabilities should be used together to make more accurate probabilities on diagnoses for individual patients, and while they're doing their assessments for greater accuracies. On this slide, we have an ethical and professional quandary. So the scenario is a professional psychologist that still uses the MMPI instead of the current MMPI-2. The MMPI-2 has superseded the MMPI, and this psychologist in this scenario is he refuses to utilize the new MMPI-2 method. And is that unprofessional? The psychological response is the counselor's professional judgment is essential. The use of several methods to establish validity is usually preferred, so the fact that he just wants to use one is concerning. Psychologists should always stay current and educated on new methodologies. So my thoughts on this is the counselor's unwillingness to adapt to current methodologies of assessments is unprofessional to an extent. He should stay informed and educated with new current testing procedures, as they have all been updated for mental health diagnostics. However, the counselor is using his professional judgment when deciding what methodology is congruent to that of his assessing patient. However, multiple methods should be used for the evaluation together and ascertain as much evidence as possible before ruling out any diagnoses. So, relying on one method is a quandary. The counselor should address and further his expansion of assessment instruments. American Psychology Association 2010 affirmed that psychologists utilize assessments instruments that have conducive validity and reliability that have been tested on a populace. The MMPI assessment tool is still widely used in psychology evaluations, and like all methods is imperfect. Considering that no test or assessment tool is perfect, it becomes up to the transgression of the professional to make sound judgments. For prognosis, still psychologists must stay relevant to avoid testing inaccuracies. On this slide, we're going to talk about evidence-based medicine. The summary and the elaboration. The evidence-based medicine slide is based on Jungstrom's 2013 psychological assessment theory that directly links medicine to the individual's clinical prognosis. Medication should not be given to any individual unless there is supporting evidence that they have a treatable diagnosis and the desire of the patient to receive additional pharmaceuticals. Dialogue becomes a critical tool for clinicians assessing individuals, as some may not want medications to aid their treatment plans where some might. Each assessment tool is weak in its own sense, but paired with other methods such as clinical expertise, research, and patient values ultimately strengthens evidence-based medicine. And note that I said treatable, not curable. Mental disorders pharmacologies are meant to reduce symptoms associated with the disorder, never a cure, and they're often always paired with therapy, psychological help. Together, that can combine help to alleviate some of the symptomologies, but it's not a cure. An example of medication best paired for clinical prognosis and EMB would be For instance, GeoMind mental health map genetic DNA test. GeoMind testing uses a plethora of assessment-based clinical diagnosis and then uses one's genetics to pair an individual with the best medicine based on evidence to support the paired pharmaceuticals. Ballinger 2022 affirmed that professionals pair clinical examinations to assess proper diagnoses and then utilize genetics GeoMind testing to concur results for genetically adhered body absorptions, thus evidence-based medicine. Again, I really like visuals, and this kind of puts everything that I said into an image. You have research, clinical expertise, evidence-based medicine, and patient value. So everything kind of constructs together to examine what medicine best pairs with all the surrounding notions. Clinical instruments, or here we have intolerance of uncertainty, IU. It helps test emotional disorders, depression, OCD, anxiety. My research hypothesis, for example, would be patients exhibiting traits of clinical depression usually suffer from additional disorders that lead to implications of stressful uncertainties. Using the intolerance of uncertainty scale for measurements, to test variables noted probabilities in relation to the hypothesis. Interrelations using the instrument of intolerance for an uncertainty scale assessment tool to test the hypothesis. Let's say a sample of 40 randomized patients who suffer from depression. Also confirmed they had other emotional disorders such as anxiety, OCD, and intrusive thoughts. The scale confirmed in the mock assessment, taken from the sampled populace of individuals, had cognitive skills measured by the IUS intolerance for uncertainty scale that was implicit in reactive situations. Uncertainty construct, those who suffer from emotional disorders do not fare well in cognition outwardly affecting behaviorisms. Fergus 2013 confirms that stressful scales used to rate intolerance for uncertainty use a plethora of quantitative data such as ranges of determinations that depict patient feelings of mental identifications, such as the uncertainty of implications. IU examines symptoms and then applies scale data to constructs measurements in which the patients were surveyed. Thank you for watching my presentation. I hope you guys all ascertained a plethora of knowledge. If you have any questions, or please reach out. Thank you so much.